Okay, we're back from the break, and very interesting call from Ray the Flagman, and I appreciate his input on the show. One of the things that has come to mind with regards to diabetes, which I think is very important, is this thought about average blood sugar, which is hemoglobin A1C, which is a test that a lot of people who have diabetes will get their physicians to run about every 6 to 8 weeks, or maybe even further. But actually, it should be checked on a minimum every 6 weeks. It's a test where sugar molecules actually stick to your red blood cells. And that's why it's called hemoglobin, which means blood, and then A1C, which is an average blood sugar attachment to that. So the higher your blood sugar goes, the higher your hemoglobin A1C, and this is an average over the past 6 weeks. So if you change your diet, or you change your regimen, or you change anything in your treatment, you would not want to recheck your average blood sugar for at least 6 weeks, and that's how long you have the washout on that for. But one of the things that is very useful is, as you get older, your average blood sugar should kind of equal your age. And what I mean by that is if you're 60, then an average blood sugar of 6.0 to 6.5 is probably adequate. As you get to 65, 6.5 would be very adequate. And as you get into your 70s, 7.0 would be about adequate, and 75 on up, you would want to stay within that 7.5 to 8 range. The theory is that as you age and later in life, you are basically not going to benefit from preventing the long-term side effects of diabetes by having a blood sugar of 6.0. Remember, this is an average blood sugar. So if we take a number 6, we're above 6 as much as we are below 6. And the risk of you, as you get older, you lose some of your stability, you lose blood volume. There are a lot of issues that go on in your body. There are a lot of changes, and your body isn't resilient like it once was. So basically, a low blood sugar could cause a fall. It could cause a hip fracture. It could cause a subdural hematoma. As we get older, we're more likely to bleed in our brain. We're more likely to have weaker bones in a fracture. A hip fracture could be a life-ending event in a 75-year-old, whereas an average blood sugar of 7.5 would not be. And the same is true with blood pressure to some extent, in that we want to have a higher blood pressure as we get older. We want to be in that, if we're in our 60s, we want to be in that 140 range. And if we're in our 70s, we want to be in the we could be in the 150, not higher than 160. But those targets have been redesigned lately, because when you're in your 70s, you're not trying to get to, it would be nice to live to 100. It wouldn't be nice, but if the quality of your life is there, that's a great thing. But when you're young, in your 40s and your 30s, you're trying to prevent the late stages of these diseases, such as blood pressure running really high from your 130 if you're in your 30s. That can kill your kidneys. That can slowly wipe out your kidneys. And there's been some link to Alzheimer's-related diseases with high blood pressure in your 30s and 40s. Because that takes time, that takes the effect over time, and wipes out some of the smaller circulation in your brain and your other structures. So controlling blood pressure in the low 130s, 120s is very important when you're in that 20 to 30 to 40 range in age. But when you get older, it's again more useful to have higher blood pressure. Your blood vessels are a little stiffer. They're a little bit more on the narrow side. So a higher head of pressure ensures perfusion of your organs and ensures perfusion of your brain. And those are all very important for you to be alert, to be active. It's also important to keep in mind, and I see it all the time, I've talked about it numerous times on this show, making sure that if you're on sleeping medications, or if you're on other pain medications, to make sure you're testing your oxygen levels, or asking your provider to run an overnight pulse ox on you. Because as you sleep, patients say, I sleep well. I sleep very good. I know I do. I don't really ever wake up. But you don't really know how well your system oxygenates during that sleep. And when your blood oxygen level falls below 88% saturations, then you will put a strain on your pulmonary vasculature, which is a very low pressure circulation, which in turn can put a strain on your heart, and that could be linked to one of the reasons that we have heart disease and heart attacks over time. Not to mention the fact daytime fatigue, falling asleep, not being able to concentrate. That is a risk for males, again, for low testosterone. If you don't sleep well at night, if you don't get that REM sleep, your testosterone cuts down, then you start to develop abdominal obesity. Abdominal obesity, in addition to reduces testosterone production. So all of these things are linked. Everything that we do to ourselves is very much linked together. And I've always stated that eating right and exercising is important. And it's not just hogwash. I mean, I see it all day long. Just a little bit of activity after you eat, and I'm telling my diabetic patients this, it's very important for you to get up and walk after you eat. It's probably the most important thing you can do to help prevent obesity, weight gain, high blood pressure, diabetes. All these things are extremely important for your prevention. And I don't know how many times I see patients and I joke with them and I say, well, you know, I know you're going to say this. If I was known I was going to live to be 75, I'd have taken better care of myself. And you know, it's all about life decisions, meaning that if you are taking good care of yourself and you are moderate in your activities, then you will get the full benefit of your life. If you will, and when I mean full benefit, I think we have a finite number of days we're on this planet, and then something happens and we die or we go home. But it's how those days are lived. It's the choices that we make determine the quality of the time that we have. So you want to get the quality, the best quality you can out of the quantity that you are given. And with that being said, if you abuse your body, then there are a few people that are unbreakable and they can endure all of it. But by far, most of the people do eventually succumb to their bad behavior with regards to, you know, gluttony at the table and overeating. And these changes are very slow. But when they hit you, they do hit you, and there is no reprieve, meaning you're going along and you're doing well. I love that commercial on the TV where it says, you will have your heart attack at 2 p.m. today, and the note says, you know, your heart attack will not come with a warning. Well, that's, for the most part, that's true, but I think there are some signs and symptoms that people do have that can prevent that. But if you are involved in risk behavior, which would be, you know, smoking and not exercising and eating a high-fat diet and doing things that are unhealthy, then you will eventually have a bad event. And once you have one bad event, you will have other bad events. It's just like the engine. If an automobile, once you lose a valve, then you may end up losing a piston. Once you lose a piston, you may end up losing something else in there. And it's just like a domino effect. One thing starts to go, and then they all start to go. So to avoid that, I think it is important for you to deal in reality. It's important for you to understand that anything bad can happen to you if you don't do the right things for your particular body. So again, moderation is the key to your blood sugars, it's key to your blood pressure, it's a key to eating. Everything has to be in more or less in balance. So remember, your average blood sugar equals your age. It's very important. Blood pressure doesn't need to be as low as it needs to be. And talk to your physician about that if your blood pressure is running too low. And if your blood sugars are running too low, it is important for you to balance out that treatment so that you can have a better quality of life. Let's see. So one of the things I did talk about on a couple of previous shows was that came up again in my office, which was the Prevnar 13 pneumonia vax. That is the one that was used in children, and now it has become available for adults. We are not in the flu and cold season at this particular point, but it is important for you to think about getting that pneumonia vaccine. If you've had the polysaccharide 23, you must wait at least 6 months to get the Prevnar 13. But that's the one I would get. It's a little more expensive, but it's the newest one, and the TV show commercials are actually a little bit correct in that. We are in the summertime, so it's very important for you to keep up with your fluids. We have what's called insensible losses in our body, losses that you can't measure, meaning you can see how much you urinate every day and you can measure that, but we will lose about anywhere from 250 to about 400 cc's of fluid through our skin and through our breath. The hotter it is, the more we lose. So if you just matched your urine output with your fluid intake, you would eventually become severely dehydrated because you're losing 400 cc's a day. So with that, you need to make sure that if you're going to be outside, that you hydrate yourself before you get outside. Do not try to play catch up. That's a very dangerous situation. You can't possibly do that. So if you're going to be working outside, make sure that you hydrate till your urine turns nice and clear. That means you've got maximal volume, not this dark urine that you always get every morning. And then you're free to probably go outside and keep up with your fluids. And then you won't be playing catch up. You'll actually be ahead of the schedule. Now, one of the things I found recently was a vest from, I think, Do My Own Pest Control. It actually was a vest that had some cold packs in there, like 2 in the front and 2 in the back. So if you work outside, and someone said, yeah, the people that get up in the attics use them all the time. Very important. Those are very useful for those people that are going to be outside. They actually cool your core body temperature as so to prevent heat stroke. And it's called, I think, domyownpestcontrol.com. Look for their cool vest. They're not cheap, so it's not like everybody can afford them, but they are very useful if you happen to be working outside. Use sunscreen, and again, sunscreen is rated as, if it says SPF 15, then that means if you applied it and kept it on and you were out in the sun for 15 hours, you would get the equivalent of 1 hour of sun without sunscreen. So divide the number by itself, and that will tell you what the equivalent 1 hour of sun exposure would be. And you would have to be in that sun 15 hours to get the equivalent of 1 hour with sun. Be sure you reapply it if you're in the pool. There's a tremendous amount of melanoma and a tremendous amount of skin cancer out there. It's surging. It's a big time killer, so you want to be very, very careful about using sunscreen when you're out in the sun. Okay, we're going to take a break, and then we'll be back after the break. Thank you very much.